So the pelvic girdle is composed of two bones called the coxal bones. So there's one coxal bone on the right side of the body, and there's another one on the left side of the body. And this is one model of one of the coxal bones. This is the right coxal bone. So the coxal bone can be divided into three regions. So the ilium would be about right here, the ischium, which would be kind of up towards my thumb here, and the pubis is down kind of where my pinky is at. These three regions were separate bones during development, but they fused together to become one piece of bony tissue. So the first structure that's probably pretty apparent is this really large cup-like depression here at the site where the ilium, which is about here, the ischium, and the pubis all come together. And this cup-like depression is called the acetabulum, and this is where the head of the femur actually connects to the hip bones. So the ilium makes up this superior part of the coxal bone. This ridge that you see here is the iliac crest, and this is actually, in a human skeleton, would be on the superior part of the ilium. The crest ends anteriorly at this little point right here that's called the anterior superior spine, and the crest ends posteriorly at the posterior superior spine. Now, both of these spines are attachment points for muscles of the trunk, the hip, and the thigh, so those spines serve as attachment points for several muscles that cross the hip, the trunk, and the thigh joint. On the posterior side of the ilium here, you see this really deep indentation here, and this deep indentation is called the greater sciatic notch, and this is where the sciatic nerve that serves the lower limb passes by the pelvic bones. So now that we've looked at the ilium, let's take a look at the ischium. Now I'll kind of turn it around here. So the ischium makes up the inferior and posterior part of the coxal bone here. So this thickened patch that you see right here, that's called the ischial tuberosity. And that patch of bone supports our body weight when we sit down. We see that it's also the site of attachment for the hamstrings muscles that are found on the posterior part of the thigh. The ischial spine is this small projection right here that's just above or just superior to the ischial tuberosity. It's the site of attachment for a ligament that supports the hip bones to the sacrum, which is the end of the vertebral column. And just underneath the ischial spine is a little notch here called the lesser sciatic notch, which is another location where nerves and blood vessels pass by the pelvis as they make their way down to the lower limb. Finally, we have the pubis, which makes up the anterior portion of the coxal bone. Between the ischium and the pubis here, we have this large opening that's called the obturator foramen. This is a site where blood vessels and nerves can pass through the pelvic bones on their way to the lower limbs. So we have another anatomical location where nerves and blood vessels can pass through the hip bones on their way to or from the lower limbs. The pubic crest is a ridge of bone on the anterior portion of the pubis here. And just between the two pubic bones, which would be right here, so if I had a left pubic bone, then we could put these two together as one complete set of hip bones here. But typically in a living skeleton, what we would have here is we would actually have a small disc of fibrocartilage called the pubic symphysis, and the pubic symphysis is what connects the right and left coxal bones together.